Meningitis is just an inflammatory disease and depends on the area that is affected. It can produce some clinical signs or others. It can be anything. I mean, it can be seizures, it can be abnormal mental state, it can be a dog that is sleeping a little bit more lethargic, maybe a patient that is just walking in circles, maybe head pressing, maybe nothing much. In terms of myelitis, when you have an inflammation in the spinal cord, you have pain. Sometimes I say even that it can be because of stress. We know that the stress plays a big role in our immune system, so you really need to push them to go ahead with more investigation because you are missing something, that's for sure. You don't treat them, they can die, okay? So we are talking about something really serious and the owner needs to be aware about this condition because sadly meningitis, anything can change. We have to do everything as fast as we can. You can use prednisolone alone, that is really cheap, it's a cheap treatment, but has a lot of side effects, mainly in large breeding. Most of them, if they are part of that 2/3, 70-75%, they do really pretty well. Yep.
Hello and welcome to another episode of Tea and Tales. I'm here today with Dr. Cristina, veterinary neurologist, to explain and speak to us about meningitis.
Yeah, thank you for inviting me, Megan.
Thank you for coming because meningitis, obviously we have it in humans, so people are somewhat aware of what meningitis is, but I think in pets, people don't really have a clue what it looks like, what it means, what's the prognosis.
Yeah, I think it's a common disease more than we expect, and actually it's true that it's known in human medicine and the prognosis is not really good. But in our case, we have chances, and I'm happy to share it with you because I think we always have to try to treat them.
Of course.
Of course.
So tell people, just to sum up, what is meningitis?
Meningitis is just an inflammatory disease and depends on the area that is affected. It can produce some clinical signs or others. Mainly it's affecting the brain. We call it meningitis or meningoencephalitis, but it also can affect the spine, and in that case we call it myelitis. So depends a little bit on the location, you will have different signs.
I'm assuming then, depending on the location, the prognosis is going to be different and the symptoms and everything.
Yeah, of course. If you have signs or you have a location intracranial in the brain, you are going to have severe clinical signs. So yeah, in that case, the prognosis is a little bit more complicated. But even depending on the location, but more or less 2/3 of the patient, they respond really well to the treatment. So this is something that we have to keep in mind.
That's very positive,
Yeah,
actually.
it is.
It was interesting, just before we started the podcast, you had said to me that the really interesting thing about meningitis is like the symptoms are everything.
Yeah.
Basically, it can come in any way, shape or form.
Yeah,
and
exactly. This is very interesting, as you said, and I think it needs to be always in our differential diagnosis. Even if you have a patient that looks completely healthy but has seizures, you don't have to assume that you have an idiopathic epilepsy. Maybe you have to put always in your list that you have this meningitis, an inflammatory disease.
I'm thinking actually, whenever I get like a referral from you for the physio, like a lot of them are obviously neuro cases, there's somewhere in there like possible meningitis.
Yeah, true.
All the
True,
symptoms.
exactly. No, it's funny because it's true that you can have so many clinical signs. That is one of the most interesting diseases, at least for me.
And as a veterinary neurologist, do you see a lot of the times it comes in misdiagnosed or missed because of that, because the symptoms are so broad?
Yeah, exactly. I have a lot of cases that sadly come a little bit late. I mean, like they diagnose them with epilepsy and they just come to me because they have a refractory epilepsy. It means that the medication is not working. And then you start checking the patient and doing a proper examination and you realize that you have some changes that maybe they were not there before, or maybe sadly we miss them. And yes, the prognosis changed a lot because as soon as you can start the treatment, that prognosis is going to improve. Or patients that come with ataxia or maybe some deficits in the gait, and they say that is an IBDD because it's super common, and maybe you have a myelitis. So yeah, this is really, really important.
I guess it's an interesting point you said about IBDD. Like maybe they would do MRI, and I think like 80% of MRIs you do on animals will show some variation of kind of disc bulge. So you would do the MRI, we see a little disc bulge. Yeah. I'm sure it's IBDD. And then
yeah, exactly. But well, it's also important to know that at the end, when you do an MRI, when you do this kind of imaging test, you have to try to correlate what you are seeing and your clinical signs and your differential diagnosis. That's why we have protocols, and I think we discussed this at the beginning with the epilepsy when we did the podcast. Like you have protocols, and you have to do a complete examination, a complete full medical history, so you can put everything together in the same picture, and then you decide on the best on the diagnosis that fits better for you. But yes, you cannot miss this kind of disease. It's true.
Yeah, I'm sure there's like a few symptoms that it's so easy to kind of be like lead you astray to something else. Like, yes, this. Probably it's whatever you said, IBDD. But if you don't do the full...
Yeah, exactly.
You said it was quite vague, all the symptoms, but could you give us some kind of key things that you usually see in the two different types of meningitis?
What do you mean?
Like the symptoms in the brain versus spinal cord.
Okay. Yeah, in terms of brain, it can be anything. I mean, it can be seizures, it can be abnormal mental state, it can be a dog that is sleeping a little bit more lethargic, maybe a patient that is just walking in circles, maybe head pressing, maybe nothing much. So yeah, that's why. Maybe nothing, and slowly that inflammation is reaching a point where suddenly the dog starts seizuring. But sometimes even if you ask the owners, like, you saw that for the last month, maybe he was a little bit more tired or lethargic, but I thought it was the summer. I thought that we were traveling. So you saw that sometimes the owners always try to find the reason behind that change, that mild change. And sometimes it's you just have an inflammatory disease, and yes, you have this meningitis.
And is seizuring, you mentioned she's seizuring a few times, is that quite frequent?
Yeah.
That would be one of the key kind of...
Yeah, exactly. And in terms of myelitis, when you have an inflammation in the spinal cord, you have pain, okay? It's something painful. That's why I don't know if...
Compared to the brain, it wouldn't be painful?
No, the brain is not painful. In human medicine, they describe some kind of migraine or headache, but it's not really painful. It's painful when it's affecting the neck. Even sometimes in kids in hospital, they just move the neck sometimes to see if they are a little bit stiff or they are having some pain. This is the same in veterinary medicine. And
yes, so the neck pain is very...
The neck, if it's in the spinal cord, yes, it's going to be painful. And of course, you can have a patient that is having systemic signs like not feeling well, lethargic, not eating well, and problems in the gait. That's for sure.
Okay. Dogs versus cats. Is it more common in one of those? You see more in dogs, more in cats? Dogs. Is it happening in cats?
Yeah, it's happening in cats, but the main difference is that in dogs, it's mainly, I would say, 99% of my patients is mainly immune-mediated disease. So it means that their own immune system is attacking the nervous system. And in cats, it's mainly parasites, virus like FIP, toxoplasma. That's not that common in dogs, to be honest.
Oh, could you explain that to people then, that the difference causes, I guess is what you're saying, of meningitis?
Yeah, mainly in dogs it's immune-mediated, okay? We don't really know the physiopathology behind it, but we know that immune system in some point gets a little bit crazy and starts attacking the nervous system.
For no reason that we know of?
No, we assume or we suspect that sometimes after few vaccines, that vaccine can trigger a little bit this disease or this condition, but mainly you have to have predisposition, okay? It's very weird to happen randomly, and as we see daily, like we do vaccination every day and how many patients develop. Exactly, but sometimes if you just read the history and as per the studies, yes, few weeks before the first main signs, they did some kind of vaccination, and maybe it's with rabies. But sometimes no. Sometimes they just show up, they are completely healthy, and after 1 week they start changing, and suddenly you realize that you have something a little bit more serious. And in cats, yes, it's mainly toxoplasma that is treatable. They do pretty well, to be honest, and FIP, of course, this viral disease that can affect everywhere, and one of the places is the nervous system.
So do we see in cats this immune, as you said?
It's described. I've never seen it.
You've never seen it, so it is quite rare. Wow.
Yeah, it's quite rare.
And you said earlier as well about the dogs being predisposed to it. Does that mean there's certain breeds that would be seen more often? Okay, people love to know which breeds.
Yeah, for sure. French bulldogs, poor things,
bulldogs.
They are always there.
Yeah,
they are always there. French bulldogs, I will say, white dogs, Maltese, Chihuahuas. Yes.
Is there a reason behind the white dogs?
No, not really. It's just because Maltese, they have more predisposition. Chihuahuas too, the one that are really light. Before they used to call it the shaking white disease, something like that, and it was mainly meningitis, but with other names. So, but yes, I think any breed can be affected, but mainly those two. Even
do you see a lot of Yorkies? I feel like I've seen a lot of Yorkies with it for some reason, but maybe that was just
the problem with Yorkshire Terrier is so that they also have them, but the one that they have is really, really nasty. Okay,
yeah, that's what I mean. I remember seeing like a few really bad cases.
Yeah, it's called necrotizing meningitis, and as the name, it sounds really horrible. So it means that tissue in the brain, apart from getting inflamed, it really gets necrotic, destroyed. So the prognosis is really, really poor. I think it's one of the. Remember when we were saying about the 2/3 that they do really well? This is the 1/3 that you cannot save them. This is almost impossible. I think I have just one of them that is a Chihuahua with a necrotizing meningitis and still okay after 1.5 years. But the prognosis is really, really bad, and we always have to keep this in mind.
And again, there's no reason for it to be that type of meningitis compared to the other. That's
more
just
predisposition.
The type of one.
Yeah, more predisposition in few breeds. Yeah.
Wow. So you've kind of gotten into the causes and types, bacterial, viral, and parasitic causes.
Yeah.
Age, does that play a part? Like it's more common in older pets, younger pets?
Well, as per the books, yes. Below 6 years, below 6 years, you have more chances to have meningitis or this.
You're not a human doctor, but is that the same in humans? Like you see it a lot in children? Or?
I think it's more common in kids.
Yeah, I feel like I hear about it more in children.
I think it's more common in kids, yeah. But here, yes, apparently, well, as I said, like the theory, it says like below 6 years, they have more predisposition. But just last week, I had one golden retriever of 1 year and a Labrador of 10 years. So I mean, even though if the main condition it's in small doggies, Maltese, French Bulldog, large breeds, they are also affected, and it's really, really common.
And can it start from infections elsewhere in the body? Or it has to start in the spine?
No, that's a very good question. Yes, we have, as I said, for example, toxoplasma. It's true that sometimes we have systemic signs and then it can migrate directly.
Explain to the people what is toxoplasma as well, for anyone wondering.
Well, toxoplasma is that famous parasite that is a little bit risky when you are pregnant, but it's really, really difficult to be transmitted, to be honest. It's just a parasite that is usually in the stool. So sometimes it's true that if the place is not really hygienic, it can really be there, I mean, but again, in cats, it can produce some systemic signs, some problems with the bloods, with the lungs, some respiratory issues, and in neuro, it produces the same. It can produce some spinal abnormalities, some intracranial abnormalities, but sometimes again, you don't have anything on the system and jumps directly into the brain, and sometimes gets stuck there. And once your immune system decides to be a little bit more low, I will say a little bit more down, is when the parasite can progress.
Okay, so you could have had it for years, you wouldn't know, and then you get some kind of illness, or like you said, maybe this vaccine that kind of brings your immune system down.
Sometimes I say even that it can be because of stress. We know that the stress plays a big role in our immune system, so we assume that it's the same in pets. So that's why sometimes when the owners are traveling, and sometimes the pets get a little bit more stressed, and sometimes can be related. Again, it's not really clear.
I'm going to terrify people.
No, poor thing. No, it's not that common. I mean, it's common for me because I'm doing this, but it's not that common. In terms of bacteria, this is super important. In this typical doggies, French Bulldog with internal otitis or something really chronic, sometimes the tympanic membrane, you have a broken tympanic membrane, and that bacteria can penetrate and affect the cerebellum and even spread all over the brain. So yes, it's one of the main reasons, a part of immune-mediated disease in dogs, where you can have a bacterial meningitis.
Wow. What are the kind of symptoms owners should never ignore? You've said that it's vague, and you said it can be everything.
Yeah.
But is there anything that ever you get like a straight away, like, ooh, that could be meningitis? It's a really key.
Of course, seizures, we have to always check them. I think mild changes, the owners know better their pets than us. So if they feel that something is not normal, that the pet is a young animal and actually is completely fine, and then after a couple of months we see that they are decreasing their energy or sleeping more, we have to check them, okay? This is super important because sometimes you miss or you delay the treatment on these diseases, and I think it's one of the things that they really need to keep an eye on.
Or would that be another thing not to ignore? If owners are treating whatever neurological issue they have and it's not working, the medicine, would that be something that kind of raises like the kind of red flag for you? Like, that doesn't seem like it's the right diagnosis.
Sometimes I have owners that they don't want to do any further investigation, or maybe they cannot. I mean, it's something personal. And then you start treating, for example, epilepsy, or maybe you assume that they have a disc, it's a predisposition, French Bulldog or Dachshund, and then you realize after a couple of weeks that they are not getting better, that they are developing more clinical signs. Even in seizures, they develop status epilepticus. That is a really a critical situation, and that's when you really need to push them to go ahead with more investigation, because you are missing something, that's for sure.
So tell us about the investigation. What does that usually involve?
We always do complete blood tests, okay? We need to investigate infectious diseases systemically. I mean, like leishmania or toxoplasma, neospora, this kind of infectious diseases. But that's mainly to rule out
something else.
Exactly, because it's very, 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 very unlikely to find something in the blood, to be honest. Usually they don't have fever except one of the type of meningitis that is arteritis meningitis that responds to steroids. I mean, it's another type of meningitis, but mainly like physically they look really well, but they are not. Okay, so that's when
a lot of the tests will come back normal.
Yeah,
okay.
yeah, exactly. So that give you exactly like sometimes when they say, "Oh, my pet is really lethargic lately, but is eating, is doing pretty good, but something has changed," and then the GP just do all the tests and no, everything is fine. You can go home.
A little quiet.
Yeah, exactly. Sometimes it's like, no, you are missing something. Yeah, exactly. Super easy to miss this. And then, of course, you have to jump to further investigation, MRI, CSF. And
so would all kind of cases need some sort of imaging to get a real diagnosis?
100%, yeah.
Okay. So what about the safety of anesthesia in these cases? If these dogs have meningitis, we're doing MRI or CT, and we're assuming we need some kind of anesthesia. Is that some kind of risk, or how do we calculate that?
Always MRI, never CT scan for the for the brain. But yes, we need to do an anesthesia, and again, sometimes they are pretty okay, like pretty normal. But when you have a patient with status and with even a abnormal mental state, sometimes they come completely unconscious and that's a little bit more risky, even though if we do a quite safe anesthesia, they are super well controlled and we adapt the protocol, depends on the patient. And it's not something painful, so something mild really can allow you to do the test. But we have to keep in mind that, yes, the risk is there, but I think the benefits are superior than the risk and you need the test anyway because you have to have a diagnosis. Exactly.
And you said earlier a little bit about the early diagnosis making a big change to the outcome. Yeah. So what is do you have a timeline of like, if it's in the first few weeks where you see great results, if it's after a few months?
No, like after a few months, most likely the patient will not be here anymore. So this is a life-threatening disease.
Needs medicine. It's not getting better on its own.
No, not at all. Unless they have very mild clinical signs and they are lucky and they have this inflammatory disease that is progressing very, very slow. This is not really common because you have to understand that when the owner or even me, we see the clinical signs, has been there for a while.
Yeah, we're seeing something.
Exactly. So you have to treat them in the first few days or the prognosis. Wow. Yeah, we are talking about something serious. Even though if I'm very positive with this disease, I know how to handle it. And I think the prognosis, if you do things well, it's going to be big, okay, 2/3. I mean, like 70-75% of the patients, they survive and they have quality of life in long term. But if you don't treat them, they can die, okay? So we are talking about something really serious and the owner needs to be aware about this condition because sadly meningitis, anything can change, So it's something that they have to know.
Is that something you personally have struggled with, that they come in, they're not great, but like you said, it's all a bit vague and the owners kind of want some time to, I'm sure it's expensive, there's costs it's adding up. Like, let's see how they get on. Is that something you have to kind of be like, we can't really be seeing?
Not that much, to be honest. I think when they come to me because they are really desperate or something is changing and they don't know what to do with them. So I think from my point of view, it's really easy for me to convince them to do the MRI, even though it's in their mind, like, let's do something today. And usually in this kind of patients, I don't wait a few days. I do the MRI the same day because it's really important. And as I said, sometimes they just arrive to my consult a little bit late, so I cannot keep postponing this. It's their life and they can die, as we said. This is something really serious. And we have to do everything as fast as we can.
Wow. Let's get a little bit into the treatment and prognosis. So you've said it's treatable.
Yeah, it's treatable. As we said, 2/3 of them, they respond pretty well to the treatment. When I'm saying this, it doesn't mean that they are going to be fantastic without a treatment. Some of them, yes, you can remove the treatment, you can wean off for 6 months, and then after that you don't see them anymore, which is fantastic. But only a small percentage, they need medication lifelong, okay? And it doesn't mean that they are going to have poor quality of life or they are going to be struggling, not at all, but they need this medication lifelong.
And what you were saying, the percentage, a small amount would need the lifelong,
it's a small amount.
And a lot of them can be weaned off.
Yeah, most of them.
What kind of treatment is it usually?
You can use prednisolone alone. That is really cheap. It's a cheap treatment, but has a lot of side effects, mainly in large breed. In small breed, actually, they handle it much better.
What kind of side effects would you see in the larger breeds?
Everything, sadly. Yeah, like pancreatitis, gastrointestinal signs, muscle, they lost muscle tone, diarrhea, even some wounds, some problems with healing, like anything, okay? In large breed, sometimes it's not the best option depending on the case and the owner, even though if it works also pretty well. And then you have a mix of combination of medication like steroids, very low dose, so we can minimize the side effect, plus another type of immunosuppressive medication, chemotherapy or other type of medication that can help you not only to reduce the inflammation, also to try to stop that immune system and to try to give in time to reset, I will say. So it will hopefully stop attacking the nervous system.
Is there a minimum kind of time for the duration of the treatment? Like needs to be at least
3-4 months.
3-4 months.
Yeah,
minimum.
usually reach up to 6 months, but depends on the patient. I have patients that they need 1 year, another one that is 3 months, and they are fantastic. So it depends a little bit, but yes, it's more or less between 3-6 months at least.
And do you see some kind of long-term side effects with these patients? When they recover, do they recover well? Or there's some kind of
no, they can have
effects?
them. Yeah, for example, if you have a patient, the loss of vision actually is one of the reason for us to believe that they have something inflammatory, this type of meningitis in the optic nerve. So it's not only treated with an ophthalmological problem, it can be mainly neuro, and I think it's always better to check the neuro because it's a bit more important. But well, that's another thing.
Not biased. It's more
exactly, or at least more urgent. I will say. But yeah, sometimes they cannot recover fully the vision, or sometimes they keep having seizures, even though if they are well controlled. At the end, the inflammatory disease it changes the tissue, and even though if you try your best, sometimes the damage is already there.
Done,
so yeah, sometimes you have this kind of side effect, but. Again, they are alive and they have quality of life, and this is also something that we have to discuss at the beginning.
Yeah, I was going to say that must be something so important at the start of the treatment. Like, what does the recovery look like?
It's a long conversation. I need to say this kind of consults as soon as, when I'm suspecting this meningitis of unknown origin, that is also how we know the immune-mediated. It's a long conversation with the owner, so they are prepared. Then if I'm wrong, fantastic. We don't have to talk about anything else. But most of the time,
you're always like,
sadly,
I'm so glad I'm wrong about.
Yeah, exactly. I prefer them to be aware about everything because usually as soon as you talk about this, they need few hours to process this information.
It's a tough diagnosis, I guess.
It is, and
owners.
they have a lot of questions that same as us. When you are in shock, you're like, okay, you go home, and then the next day is like, oh my god, I didn't understand this.
Yeah,
exactly.
Like,
so they just come with a list. So
Yeah.
I think they need time to process this, and we have to be in the same page. This is a teamwork, and the follow-ups and the controls, they are extremely strict with this disease. So that's why I prefer to spend with them 1 or 2 hours talking about this. So they are with me. We have to work as a team, the patient, the owner, and me, and because at the end we just want them to be okay and to have quality of life and to survive. So we need all the help that
Everyone
we can
on the
have.
same page, of
yeah,
course.
exactly.
Let's do a quick myth-busting game, okay?
Okay.
Like a game.
okay, it's a game.
So, true or false, a couple of key points you can let us know and give us a small explanation if you feel like it's necessary.
Okay.
So, meningitis is always fatal.
No, that's not true. As we said, 2/3 of them they respond pretty well to the treatment.
Good.
Yep.
Only puppies get meningitis.
No, that's not true. Unless you have a viral disease, for example, distemper or something like that, or even kittens with toxoplasma, at any age you can have meningitis, so it needs to be always in your differential diagnosis.
I meant to ask, do you see they have better recovery, younger or older?
No,
No, not
it doesn't matter. No.
Okay. If symptoms improve, treatment can stop.
No, like when the symptoms improve, it means that you are doing a good job.
Let's not stop.
Exactly, that the prognosis is good. So we are happy, but no, you need to complete the treatment, and actually you have to repeat the MRI to make sure that externally what you see is matching with your brain condition, your spine condition, and everything. Yeah.
So theoretically, you'd have to continue doing the treatment. The dog is good, but the MRI keeps showing an issue.
Yeah, and actually sometimes you try to you do the MRI, everything is perfect, and you try to reduce the medication, and they start having some clinical signs. So that's a patient that is doing perfectly fine with minimum dose, but most likely they will need medication for life. Yeah.
Steroids are always bad.
No, they are not. It's one of the main medications that we use in neurology. Different doses, different protocols, but no, they can change your life. So no, we don't have to be scared.
Yeah. And neck pain can be behavioural.
No, poor things. No, if they have
It
neck
really
pain,
annoys me when I hear and I hear it from other vets as well. A lot of the time, people were like, "He's just faking his injury," and I'm like,
no, poor thing. Exactly.
I think you just didn't quite grasp what it was, or you missed what it was.
Exactly.
But I'm like,
and to be honest, I'm not saying that it's impossible, but are you going to just let him be in pain because it's behavioral. I think it's always better to check to have peace of mind. And again, if you do everything and everything is fantastic, okay, it's behavioral. But behavioral is such how
let's not jump to that too easily.
Exactly. I think it's very easy to say like, no, it's the age, no, it's behavioral. No, let's rule out medically all the clinical, all the differential diagnosis, and if it doesn't match, okay, maybe you have to even refer the case to a behaviorist or something like that. But I mean, like, let's do our job first. Yeah.
You've kind of gotten into this quite a lot actually already, but living with a pet recovering from meningitis, what owners need to monitor at home for them to understand, like, this has came back, or what do I need to be on top of?
To be honest, they know better than me because they know their pets exactly before and after, no? So anything that reminds them the first clinical signs, really, they are extremely fast. And sometimes even though if I say, I can see you in 2-3 months, after 2 weeks, like, Cristina, I noticed this and that, and they really catch things really, really fast.
Does that make it easy? Is it often the same signs from before? Because I know you said it was quite vague, but at least it will be repetitive.
Yes, I need to say that most of them, the first thing that changed when we are talking about intracranial, that is mainly what I see, is changes in the mental state. So that behavioral changes that we were saying, they are not behavioral, they are abnormal mental states. So they start a little bit more disoriented, sleeping more, not being themselves. That's the beginning of. So yeah.
Do you ever see aggression, by the way, like happen? Or is that not really a symptom of it?
Yeah, actually, I had a Labrador just 2 weeks ago with this condition, and he was being aggressive, but not because he was aggressive. He was just completely disoriented, and sometimes they cannot recognize if it's you, food, or a towel. So he was biting, but I mean, after 2 days of treatment, he was back to normal. I mean,
and that would have been very out of character for him then.
Yes, exactly. And the owners can tell you, like, this is not my dog. Like, this is not how exactly. It's a very hyperactive dog, but it's not acting like this. So yeah, that's really important to keep in mind.
Wow. You've mentioned already relapse risks and warning signs you've gone through actually.
Yeah.
And long-term management for immune-mediated cases.
That's depends, as we say, like, usually protocols between 3 to 6 months, and after that we usually see each other once or twice per year just to make sure everything is fine. But if we can stop the medication, usually they don't need me anymore. It's only this type of patients that they need small tiny things all over the time that need a little bit more follow-ups. But again, most of them, if they are part of that 2/3, 70-75%, they do really pretty well. Yeah.
Let's wrap it up a little bit, and if you can let us know if you have any cases that really stuck with you for whatever reason with meningitis, like success stories or even cases where something was unusual. Do you have any?
Well, I have, as I said at the beginning, this Chihuahua, very lovely couple, and a very tiny, of course, dog, is 1 kilo something, that she was with 6 months, actually, she was diagnosed with necrotizing meningitis, and usually after a few months, they just passed away. And after, I think it's 2 years she's been with me, and I mean, she keeps having medication, but she's doing really, really well. Yeah, exactly. And I had recently a doggy that I was hoping to help him and to, because he was coming with status, and well, sadly we couldn't save him. So sometimes, yes, it's really sad because you always want them to be in that 2/3, and even though at the beginning it looks quite complicated, you never know with meningitis, but yet few of them, they really get stuck in your heart.
I think that's the thing with all neuro cases. Doesn't matter how good or bad they are, you cannot guess the outcome that well. The one that looked great didn't have that much symptoms. Can just be...
Yeah, because I think, like, it's same as this dog. I had another French bulldog 1 month ago, a very lovely Indian family, and he was really, really bad with status epilepticus. We couldn't stop the seizures, and after 3 days we did the MRI. And he's totally fine right now, free of seizures. So this is amazing, you know. Like, you see, it's a life-changing. Yeah, exactly. Yeah.
Oh. And my final question: one thing that you wish owners knew earlier when you're thinking about meningitis?
I think what we said at the beginning, these mild changes, they know their pet better than any of us. So if for them something has changed, better to check, and maybe it's nothing, I mean, and that will be fantastic. But sometimes you have something really critical that is happening inside of them, and because they cannot really express themselves, they cannot tell you, I'm more tired, or I'm just doing this or that. Sometimes those changes are really, really important. So if something is different in your pet, please go ahead and insist for a checkup.
Even for all of the vets that we've had here, like Theodora was emergent specialist, Bea, I think, was the same thing with oncology. It's always the same thing that they say as well, like, you know your pet's best. And I think it gives a lot of comfort to people when you have your pet and you're not sure and you think you're being crazy, but it's like, you know your pet, trust your gut.
Yeah,
like,
exactly.
Really
sometimes I have people in the consult crying along, like, I was not crazy. It's like, of course not. Yeah. Like if you feel that is not, even when we are doing follow-ups and I'm doing the checkups and I see that neurologically speaking, in terms of examination, the pet is better, but the owner is like, something has changed. Let's check him, okay? Yeah. I trust them because they know it's their family. Really exactly. So please, if they say that something has changed, something has changed. Let's make sure that we don't have any medical reason behind that.
Thank you so much, Dr. Cristina, for explaining to everyone what meningitis was. For everyone listening, if you found it helpful or if you want to know more, please let us know in the comments. And we'll see you next week for another episode of Tea and Tales.
Thank you. Thank you. Bye.
Cat.